The Centers for Disease Control and Prevention released new guidelines yesterday for people who have been fully vaccinated against COVID-19. According to the CDC, fully vaccinated people can gather indoors with others that are vaccinated without social distancing or wearing masks, and vaccinated grandparents can visit healthy grandchildren. So far, around 31 million Americans have been fully vaccinated. That is about 9% of the U.S. population. Joining us now to talk more about these guidelines and what it means for all of us is Dr. Bob Lahita, director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. He is also a professor of medicine at Rutgers and New York Medical College. Dr. Lahita, welcome back. Always great to be with you. So let's talk about these recommendations. In addition to what we just mentioned, the CDC also says if you have been exposed to COVID-19, but you're already fully vaccinated, you don't have to quarantine or get tested. Talk about the significance of that for us.
That's very significant. And in fact, there's been a little pushback because the people who have not read the CDC guidelines are saying, oh, whoa, wait a minute, that can't be true. So somebody who has COVID-19, you do not need to stay away from those people if you've been vaccinated or get tested unless you have symptoms. Now, that doesn't apply to people in nursing home, long-term care facilities, or in prisons or places where there are a correctional facility where people are liable to be infected. If that's the case, then you should be quarantined for 14 days. And of course, in all of these instances where you don't know the people you're dealing with, you should wear a mask, social distance, and make sure you wash your hands, Tracy.
I know another one of the recommendations is to continue wearing masks out in public, even if you've been fully vaccinated. And I know a lot of people may be thinking, well, gee, I got this shot. I thought I was protected against the virus. Why do I have to wear a mask?
Yeah, well, one of those issues is, and it still contains, we have variants out there. We have the South African, British, and the Brazilian variant, and we're worried that people can be carriers. They can be vaccinated and be fine as far as themselves go, but they can transmit the virus to someone else. So there's a little disconnect. If you're sharp, you see the disconnect between the CDC recommendations and possibly the issue of transmitting the virus if you're somebody who's asymptomatic. So that's why we want you to wear a mask and continue to mitigate until such time as we have herd immunity.
Yeah, and I was going to ask you about that. We're hearing about people catching the virus after they've been fully vaccinated. Why exactly does that happen? And is it sort of like, say, the flu vaccine? If you're vaccinated and you get the flu, your symptoms aren't as severe. That's
correct, Tracy. If you have the COVID vaccine, one of the three, you will not enter the hospital, be admitted to the hospital. You may get sick, but you will not be admitted to the hospital. And the most important thing is you will not die. And, for people who have lost members of their families, et cetera, this is big news because we've lost so many people in the spring and summer of last year. So you need to know that the vaccine is protective. But, the flu vaccine, Tracy, only protects us 40% of the time. So you can get a mild case of the flu after getting the flu vaccine. Here, we're talking 90s, and I think the lowest number is between 75 and 80% protection. So it's really, really good.
And before I let you go, it's hard to believe that this time, a year ago, then President Trump announced guidelines to help stop the coronavirus. Initially, it was just 15 days to slow the spread, and now here we are. Can you talk about where we were, where we are now, and maybe what our future looks like? When do you think we can get back to normal?
Well, we were in a bad state in the spring and summer of last year. And at that time, we were totally quarantining everyone. And remember, we were struggling to get tested. I can remember sending tests off from patients in the hospital, which would take upwards of 6 to 7 days to come back. So we had people under investigation. We call them PUIs, and we had no idea. And we couldn't seem to control or get ahead of ourselves. Then the warp speed attempt to make this vaccine came about, and we started immunizing people in December. And now we're getting test results, PCR tests, rapid saliva tests, blood tests looking for neutralizing antibodies. All of that was coming about very quickly. Within a day, in November and December, we were seeing results almost immediately. It was breathtaking. The lines were beginning to decrease in size, and people were getting tested, and everybody knew who was infected and who was not, and who had neutralizing antibody. Then came December, and the vaccine started. The vaccines were being administered slowly but surely to healthcare workers, to vital people in nursing homes, long-term care facilities, and we saw the numbers of deaths drop gradually. It didn't happen suddenly, but we're seeing now where the numbers went from, say, 200 patients in the hospital per day to now around 60. And in the intensive care unit, those numbers also dwindled, less people being intubated. We knew more about how to treat the disease, and we knew more about doing intubations and ventilating patients without intubation. So that was all very exciting. And now we're doing 2 million vaccinations a day with one of 3 vaccines. And I'm very excited to say that we're seeing this huge number, as you mentioned, 9% of our population immunized. And I have to stress that if you're frightened about these vaccines, you shouldn't be, because remember what I said, you will not wind up in the hospital and you will not die. And that's the most important thing, because I have to tell you, all of us, all of the healthcare workers that I work with, we were all afraid that the next day would be our last, having worked so closely with these patients. And we're just delighted to be able to get the vaccine. It was a real gift. Tracy.
Absolutely. We've certainly come a long way. Dr. Lahita, thank you so much for your analysis. We always appreciate you coming on.
Thanks, Tracy. Pleasure is mine.